My name is Jayleon Israel. I play for Phoenix Prep. I was down in El Paso, Texas for a tournament and I broke my tibia.
JJ had a tibial tuberosity avulsion fracture, which essentially is where the quadriceps tendon inserts on the tibia. He ripped that off the bone. So it's technically a fracture and not really a tendon injury. However, when treating it, it turned out to be more of a tendon injury just with how long it took and things like that, because the range of motion took a long time to get back as well as the strength.
Yeah, that night I actually had to take the ambulance from the gym to the hospital, stay in Texas for 2 days I think, and I had surgery that same night. First surgery, first big injury, so I wasn't looking forward to going into the surgery room. Pretty scary. That next day when I woke up in the hospital, I wasn't really looking forward to playing basketball at all. I didn't know if I'd even be able to, honestly. It's kind of scary. Probably by the time I got back to Arizona a few days later, I kind of calmed down, and the medicine was like kind of helping my pain and everything. So I kind of realized, okay, like just kind of got to like take it step by step, and then kind of slowly got back into wanting to play again.
So initially, JJ was coming in 3 times a week, and then I sent a note to the doctor. I was like, we got to get him in as much as possible to hopefully get this range of motion back. So JJ started coming in 5 days a week. It got really repetitive. We did a lot of the same stuff in the very beginning because we had to reteach the leg how to move. Getting the range of motion was very difficult day to day. Sometimes we get no progress, sometimes we'll go backwards. Even week to week, it was hard to determine where we're going to be. Some weeks we'd gain 3 degrees, some weeks we'd gain 5 degrees, so it was really hard mentally and emotionally to get through that.
When I first came in, it was just a lot of like just learning how to move my leg and lift it up off the table. Learning how to like lose my hips again and all that, and then we slowly got into bending the knee again. I had to learn how to do that again and get all of my range of motion back, and then like slowly just progressed into walking, running, and then slowly now we're back into like we're doing some weight squats and different stuff like that.
JJ's been in therapy for about 10 months now, so I've started seeing him at the beginning of the year. However, over the last couple months, as he's progressed back to playing basketball and playing in games and things like that, he just comes in and checks in with me periodically, just because he has some underlying strength deficits still and some range of motion deficits that we're still trying to work through. So the team here at Spooner Sports really helped with this recovery, as whether it was directly or indirectly. I mean, we had multiple therapists working with him. Caitlin and I took most of the work with that. However, Charleston played a big role in helping him out, giving him cues, helping him out with exercises, actually helping out his mom. His mom would come in with him every day, and then Charleston would talk to his mom or take his mom through workouts and things like that. Nick would see him periodically, our athletic trainer, help me kind of look at it from a different perspective, make sure things are aligned, and making sure he's getting ready to be back on the court.
Now that I'm playing again, it's good. It took me a while to even get the mental part of knowing that it's going to be a slower process to coming back than I thought it was, not just stepping on the court and being able to just go again. But now that it's been a few months since I've been able to play, slowly starting to see that I'm like not turning into my old self, but even better than I was before. Stronger, can jump higher, so I think that's good. Yeah, Jared's been a big part of my recovery. When I first came in, like I said, it was hard to trust him. It was hard to trust him like working with me and touching my leg, especially with it being my first injury, my first time ever having to do a recovery. So first coming in, I know it was probably hard on him too, just having to work with me and him trust me and everything too. But yeah, like I said, once we got comfortable and once I learned how to just trust him, everything worked out, and couldn't have asked for a better person to work with.